Hello, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. We are pleased to report Dare County's COVID-19 data continues to trend in the right direction. Specifically, there were only 30 new positive cases last week. This is the lowest it has been since the last week of September. Additionally, the percent of positive tests to total tests for this past week decreased from 8.2% to 7.7%. While these numbers are looking much better, we still need to remain vigilant. We have seen a recent rise in the number of cases under the age of 17. 10 out of the 30 new cases last week were between the ages of 1 and 17. Several cases were linked to spread between siblings, and 6 cases were linked to sports or social gatherings. Please continue to do what we know works to control the spread by following the 3 W's. Wear a face covering, wait 6 feet apart and wash your hands frequently, or use hand sanitizer. Since our last report on February 23rd, there have been 32 new COVID-19 cases. Of these 32 cases, 26 or 86% are symptomatic. 22 or 74% acquired the virus by direct contact with an individual or individuals who were positive for COVID-19. The total COVID-19 positive case count in Dare County is 2,784, of which there are 23 active cases among residents of Dare County. Currently, 1 resident is hospitalized due to complications from COVID-19. Sadly, 1 resident death was reported last week. Our thoughts are with the family and friends who have lost their loved one. We have good news to share this week regarding our vaccine allocation from the state. Our weekly allocation has been increased to 500 first doses per week for the next 3 weeks. Additionally, we have been approved for an extra 500 first doses this week and 1,500 first doses next week in response to the additional special event request we submitted. With this increase in allocation, we have successfully been able to offer appointments to those aged 65 and over who were on our waiting list, and we are now ready to move to Phase 3, Essential Workers. Anyone who is an essential worker may now go to our website at darenc.com/COVID-vaccine to complete the vaccination request form. Staff will then call you to schedule an appointment as appointments are available. Phase 3 essential workers are defined by the state as those who work in critical manufacturing, education, essential goods, including grocery stores, pharmacies, food service, and gas stations, government and community service organizations, churches, public health, public safety, and transportation. Over the past 8 weeks, we have administered 8,398 first doses of COVID-19 vaccines and 5,741 second doses. Over the next 2 weeks, we will administer an additional 3,250 first doses and 1,100 second doses. Each week, we review the 4 key metrics associated with disease investigation and surveillance. The metrics are number of tests, confirmed cases, positive test as a percent of total test, and COVID-like illness surveillance. This past week, there were 389 COVID-19 diagnostic tests reported in Dare County. This brings the total number of tests performed since early March to 33,626. There were 30 positive cases between February 22nd and February 28th. The percent of positive tests to overall tests in Dare County since we started testing in March of 2020 remained the same as last week at 8.27%. The percent of positive tests to total tests for the past week alone decreased to 7.7%. Syndromic surveillance of individuals presenting with COVID-like symptoms to the emergency department and urgent care centers showed low levels of activity last week. These graphs can be found on the Dare County website at darenc.com/COVID-19. We encourage you to stay informed by visiting darenc.com/COVID-19 or by visiting the CDC or NCDHHS websites. If you have specific needs or questions, you may also call the Dare County COVID-19 Call Center, open Monday through Friday from 8:30 a.m. to 5 p.m. at 252-475-5008. Thank you.